So hello everyone. Hi, my name is Karam. I'm one of the PGY2s here at Texas Rehab of Fort Worth. We also have with us our junior chief resident, Melina, and our chief resident, Atif, and our program director, Dr. Stoll. If you guys want to introduce yourselves real quick.
Hi, everybody. My name is Melina. I am the current academic chief or junior chief at Texas Rehab. Let's see. I think Dr. Stoll is online there. Dr. Stoll or Atif is too.
Yeah, I think
Hi,
everybody's
everybody.
on. Yeah, yeah.
Yeah.
I'm Dr. Stahl, just the program director. I'm happy to be here and answer any questions people have.
Perfect. So yeah, we'll try to get through this PowerPoint quick so we can have enough time for questions at the end. To start us off, our program is a newer program. It's fully accredited by ACGME. We have a main hospital we work out of is Texas Rehab of Fort Worth, which is based in the medical district in Fort Worth. It's a 66-bed inpatient rehab hospital. We also work primarily with Texas Rehab of Arlington, which is a 40-bed rehab hospital about 20 minutes away. But those are like the main rehab hospitals we'll be associated with for our inpatient rotations. Texas Rehab of Fort Worth is CARF accredited in stroke, brain injury, and spinal cord injury. Our program has osteopathic recognition, one of only 3 in the country. It's something we're really proud of. And we are also affiliated with LifePoint Health as our overall arching corporate entity. So this program is a categorical program. That means it includes the intern year. It's associated with our sister site, Harris Methodist, which is about a 5-minute walk from Texas Rehab of Fort Worth. It's a very large hospital that has the 4th busiest emergency department in the country. So we get a lot of patients from there, a lot of traumas, and it's a really good site for the interns to get a lot of good exposure. We do rotate all over, and we'll get into the rotation sites in a little bit. We have 6 residents per class, and actually, this is the first year where now we have a full complement. So, and then we are also affiliated with TCOM, UNT Health as our academic affiliate as well. So we'll have some of our didactics present in that area. As I mentioned earlier, we're now a full complement. Here's our full class from PGY 1s all the way up to PGY 4s. We'll be celebrating our first ever graduation this coming year. And we're really excited for that. So our core clinical training sites, as I mentioned earlier, we work in Texas Rehab of Fort Worth and Arlington primarily for our inpatient rehab exposure. We'll also work during your intern year, mostly at Harris Methodist of Fort Worth. You'll also spend time there for consult service later on in 3rd and 4th year. We have a variety of multiple different clinical sites you do for interventional pain, where Dr. Balch, our APD, has a clinic. We also work with the JPS Sports Medicine Residency Clinic, Stoll Neurodiagnostics Clinic, and Center for Neuroskills. This list is ever growing, and we're going to have more and more sites as the year progresses. So here's just a sample of our educational calendar. This is going to be very different as we progress the next few years, but primarily, just like most programs, PGY 2 year is going to be a inpatient heavy year. We actually are fortunate enough, we have 3 electives during PGY 2 year, which is not very common in most programs I used to rotate at. So that allows you to get a lot of exposure if you're trying to apply for fellowship. And then PGY 3 and PGY 4 year will be mostly outpatient procedural heavy. So we're based out of Fort Worth, one of the largest metros in the country. Between Dallas-Fort Worth area, you're serving over 8 million patients. As I mentioned earlier, we're hosted in the medical district of Fort Worth. So in this area, you're going to find 3 large major centers and 1 large major pediatric center. So there's Texas Health Harris, there's JPS, there's Baylor Scott and White, and there's the Cook Children's Hospital. All of these hospitals are within a 5 to 10-minute drive. So it makes it really convenient, and you'll have access to most of these hospitals when you're chart reviewing and getting admits and stuff like that. Fort Worth itself is a very beautiful city, a lot of great food. Next to the medical district, there's Magnolia Street, which has a lot of beautiful restaurants, bars, if you're in that scene. And then the Stockyards area, obviously people come from all over the country. If you want to get your country on, it's a really nice place. So here's our program directorship, starting with our APDs, Dr. Balch, Dr. Bridges, and Dr. Mitchell. You'll have the ability to rotate with all 3 of them on the inpatient side. And Dr. Balch also has the outpatient interventional spine clinic, the pain management clinic that we talked about. And then here's our program directorship, including our program director, Dr. Stoll, our newest faculty member, Dr. Lee. She's now our director of osteopathic education. And then Dr. Ryder, you'll work a lot with during your intern year. She's the IM program director and one of the core faculty members for that. So what makes this program, well, some of our big benefits that we have is for our gym memberships, we have WellHub. So through WellHub, you have access to about 20 to 30 gyms in the Fort Worth area, all included for free. You're not paying anything extra out of pocket. If you want to like buy the more expensive membership, which is like $50 to $60, you can get even more access to all the lifetime gyms. So honestly, everything that you need is pretty nice with that. We do have complimentary meals available at both the inpatient rehab hospitals. You can also possibly get meals at the main large level 1 center, Harris Methodist, which has one of the best cafeterias I've ever seen in a hospital. And we have complimentary parking on site and good salaries and benefits. So here's a image of our salary for living in Fort Worth. The rent is actually not bad. Driving is way better than it is in Dallas. And you're making good money, in my opinion, for a resident. So for our curriculum, we primarily have our didactics on Wednesday afternoons. During this time, we'll have lectures from our attendings. We'll have journal club, clinical case reports, grand rounds, SAE practice. Also, a newer thing we started implementing in the last couple of months is the Thursday noon report. During this time, we'll have like specific case presentations. We'll have different third and fourth year residents present. And then we'll also have the medical students that we work with, like have medical student presentations. One of the nice things is you'll get to work with medical students directly if you're interested in that. We have a constant stream of rotators, sub-Is coming in and coming out. As I mentioned earlier, we're associated with TCOM, which means we get access to their library for all the books, via a virtual reality sim center, cadaver lab. We have workshops for EMG, nerve conduction study, ultrasound, osteopathic workshops. And then for our mentorship, we have a wellness committee, program mentorship committee, hospital committees you can get involved in. And then from an educational standpoint, as a resident, you will get membership to AAP, PM&R, AANEM, and also the Texas PM&R Society. We'll certify you in ACLS, BLS. You'll get access to the textbooks, as I mentioned earlier, such as Cucurello and Bradham's. And you'll also get a subscription to PM&R Recap, which we use for all of our board prep. And as I mentioned earlier, the electronic library, and then you'll get a PM&R board review course, annual travel and conference attendance stipend, and an annual education stipend as well. So this is a picture of our family. We like to have fun. We're very loving. We have monthly dinners. We just went to the art museum a couple weeks ago. We get along well with our students, with all our class, and there's a lot of fun things on the horizon for us. So now I'll hand it over to Dr. Stoll, our program director, for a message.
So I think it's fair to say that my goal is that of probably most all program directors across the country, which is to provide the best education we can for the residents so that they can be successful and quality physicians and leaders in the communities in which they serve. If you read this statement, I emphasize North Texas. We would love for anybody who comes to the program to stay locally and fall in love with Fort Worth, as I certainly have. So I think I'll just kind of leave it at that. I'll be available for questions, but everybody we have a great team, and everybody seems to enjoy the program, and so we want people to come in who will do that as well.
Perfect. And if you want to stay connected with us, we're available both on Instagram and Twitter, as well as LinkedIn. That's our website right there. And then honestly, one of the biggest things, the strongest things about our program is our coordinator. Maria makes things so easy, and your program is only as strong as your coordinator. She's on top of it. She knows what she's doing. She's always helping us out. And we're very glad to have her here helping us out. So I'll open it up right now. If you have any questions, let me stop sharing my screen. We have all of us on board right now, so feel free to fire away.
One question in the chat. Hi, thank you for your presentation. Is there a minimum score requirement for Step 2 CK? Do you sponsor the J1 visa, and how is your program viewing signals?
So I can try to comment on some of that. First off, no, we don't have a minimum score. We have a pretty holistic view towards applications and through recruitment and matching. So no, there's not a minimum score for our program. The visas, I believe we do not take visas in our program. It's basically people have to be citizens at this point. We've not matured to the point we can do that as yet. And then the last question was, repeat that again, Maria.
How is your program viewing signals?
Yeah, so as everybody knows, we've increased signals nationally, and as I understand that, the point of getting up to 20 signals really means that probably most programs now will only interview people who signal them. Whereas in the past, we might have gotten 700 applications, and all of the applicants had to apply to every school in the country, and that just kind of made a lot of cost to the applicants and a lot of work that was maybe unnecessary for the programs. But if everybody has 20 signals that, and then we basically interview everybody who signals us, should save the students money and save the program's time. So I think that's the reason why they're up to 20 signals. And we look forward to this being the first year that we use that. But I think our intent is to lean into that and basically interview people who tell us they want to come here through the signaling process.
Thanks, Dr. Stoll. Next question I can take. Are you requiring a SLO? The answer is, for this upcoming recruitment season, we will be highly recommending at least one. Good question. Next question, will you have representation at the PM&R conference?
I believe that's a yes. We'll have people there.
Yes, we will have some residents, and also our corporate entity, LifePoint Health, will have a table. But stop and say hi to some of our residents if you see them.
Yeah, both at PM&R as well as AAP. I don't know if anybody is planning on attending that, but we have a strong representation at Association of Academic Physiatrists as well. Is PM&R in San Diego this year? I forget where it's coming up. But
that was last year. It's in Utah.
last year. Yeah. Okay. Thanks.
Yeah, we'll have people in Utah. We'll have people in Puerto Rico for AAP, and a little shout out for myself. We'll have people at the International PM&R conference as well this year as well.
Well, I don't see any more questions in the chat, but if anybody has anything, please feel free. We have a really open door policy. You can call us anytime, visit us. We're happy to speak with you, meet with you. So with that being said, thank you all so much.
Well, thank you. Really appreciate the presentation. Thank you so much.